We're joined by Simon Clark, a microbiologist at the University of Reading in the UK. Thanks so much for joining us. Many countries here in Europe have either imposed or are considering imposing curfews. How effective do you think a curfew is to curbing the spread of the disease?
Well, it depends on what you ban people from doing, and it depends on what time of day. Here in the UK, pubs, our public houses, our bars are closed at 10 o'clock, whereas they'd normally go for an hour and a half extra. And you do have to ask the question, how big an impact does that have? And I don't think anybody really knows for sure, because of course, when you close everything at a certain time, then people pile out onto the streets and mingle there, and that provides another opportunity for some fresh interpersonal interactions that wouldn't have been had in the pub.
So, here in France and in many other countries, governments are struggling to do enough testing. How much testing should we be doing really to make a difference?
There is no limit on the amount of testing that you can do. And as more people get the virus, as there is more virus in society, the more testing needs to be done. I mean, you need to keep on testing until the numbers stop going up. Now, they either stop going up because you've reached a point where you're testing enough of the population, or that the virus just isn't going up anymore. So they need to just keep ramping it up. It's impossible, really, to put a number on it, to say to you, so many million tests a day need to be done in order for them to be successful.
Now, several vaccine trials are underway. When do you think we could expect a vaccine, and is the vaccine something we should count on to end the pandemic?
No, it's definitely not something we should count on, because we might not get it at all. If everything goes well, and I mean everything, then we might see a vaccine available to be put into people en masse in the second half of next year. You might see a few inoculations before then, but get really big programs by the end of next year, the second half. But it could be years away if we ever get one at all. It is to be strived for, and the efforts that are being put into it are the right thing to do, but we mustn't pin our hopes on it.
Okay, Simon Clark, microbiologist from Reading University. Thanks so much for joining us.